everyone, this is the final video in our series on the Praxis content categories. I'd like to introduce Ms. Tess Martin, certified SLP and member of the team that built PrepJet's SLP program. The goal of this series is to help demystify the study process by exploring topics that are tested on during the Praxis exam. We do this by examining questions from our program that illustrate how the exam may test your knowledge and understanding of Praxis topics. For each question, we offer related study or test-taking tips. In the first three videos, we explored questions from the Praxis content categories: Foundations and Professional Practice and Screening, Assessment, Evaluation, and Diagnosis. Today, we'll focus on the Planning, Implementation, and Evaluation of Treatment content category. Exam questions from this content category may cover the range of disorders that SLPs treat, including all communication disorders and feeding and swallowing disorders. In this video, we'll be reinforcing many of the key test-taking strategies we discussed in earlier videos by applying them to different questions. Let's begin with a recall question that illustrates how the practice may test your knowledge of planning, implementation, and evaluation of treatment. Now, this question is from our diagnostic exam, which you can take for free. But the diagnostic exam is designed to identify your baseline areas of strength and weakness. So we don't tell you what the correct answers are here just because it would affect your score. But we'll share the correct answers for other questions we explored in this video. I've provided the question on the screen to the left. Tess, could you tell us a little bit about this question?
Yeah, definitely. So this is a really good example of a recall question. And recall questions on the Praxis simply require you to remember or recognize information related to SLP practice. So if you know the information, a recall question can be answered, pretty quickly. So in total on the Praxis exam, you have 150 minutes or 2.5 hours to complete the Praxis exam. So this means that you have just over 1 minute to answer each question. And usually people who have studied effectively find that they have plenty of time to answer all the questions and then also go back and review those questions. So most recall questions like this one, you probably will be able to answer in under a minute. So definitely will leave you ample time to answer any other questions that maybe you aren't as confident on. But to answer this question correctly, you just have to recognize the characteristics of a vertical strategy. If you commit this information to memory when you're studying, you're going to be able to answer it really quickly. And so this type of question is really important to study and to practice on because it really highlights the need to really study the basics of our practice, our scope of practice, our scope of practice. So don't skip the basics when you're studying. Don't just study the really complicated information. Make sure you understand the foundations too. And the other thing too about this kind of like basic information, a lot of it is stuff that you've probably touched on in your graduate school, but that may have been a while ago, or maybe that was one of your first classes that you took, when you got into grad school, and maybe you're way further along in your program. So it could just be something that you need a refresher on, or something that maybe your program didn't hit particularly hard. But one thing is really important to remember is that test-taking strategies, guessing strategies, those are all really great and they're useful strategies for taking tests, but those strategies aren't going to help you know the answer. So do yourself a favor, be as prepared as possible, just to make it easier on yourself. So even if you do know the answer to this question, it might kind of seem a little bit challenging because some of the answers are a little bit longer. So a lot of recall questions are pretty short questions with short answers. They could be 1 or 2 word answers. But some questions are, much longer. Some recall answers are much longer, like this one. So don't let it throw you off. Just take the time to read those answers carefully and in full. And don't rush to save time because you have over a minute to answer each question. And to sit there and think about a question for 1 minute, it seems like you're taking up a lot of time when you're sitting there and you're just thinking. But it seems a lot longer than it actually is. So just make sure you don't rush through your answer choices. Take your time, just be patient with yourself, and just make sure to prepare effectively for the praxis.
Thank you, Tess. Okay, let's explore another question. This one is an application question. Two of the application items we explore in this video ask about a disorder that's commonly treated in a medical setting. We selected these questions because this is an area that SLPs feel a little less confident in, both while studying and during the exam. The questions provided on the screen to the left. Tess, could you tell us a little bit more about this question?
Yeah, definitely. So, like you said earlier, this is an application question. So, typically, application questions are going to present some kind of scenario and then ask a question about that scenario. Typically, they're a little bit more challenging, a little bit more difficult than just recall questions because a lot of times it's required that you use a lot of different information, you pull a lot of different information to answer the question. So, definitely read the scenario very carefully. A lot of the scenarios are, lots of information. So there's lots of details. So just make sure to pay attention to those details and don't rush while you're reading because you have over a minute to read or to answer the question. And so when you're talking about over a minute to answer a question and you read something fairly long, it's plenty of time. I know it seems like it's kind of short, but it's plenty of time. So definitely read carefully. And usually people that have studied feel that they can answer these questions pretty confidently. So looking at the scenario, it's pretty long. Um, there's lots of different details in it. So one strategy to use, if you see a big paragraph, a big block of text, just read the last sentence of the question of the scenario. So this is going to tell you kind of the question's question. What are you actually going to have to answer about this scenario? So reading the questions first will tell you which topic is being tested by the question. So this one, it's asking which of the following approaches would be best for addressing the patient's language needs and goals. Knowing this is the focus of the question will just kind of help you frame your thinking while you're reading the scenario. So notice in particular too the language that questions use. So we're looking for the approach that is going to be the best for addressing the patient's language needs and goals. So the patient's needs and the patient's goals. And that's really important. It's not just the patient's needs, it's also the patient's goals. So make sure to kind of pay attention to the wording of the questions for sure. So looking at the scenario, we know that he has aphasia. He produces utterances of 1 to 3 words. His syntax is intact. Occasionally, he makes semantic errors that he's aware of and attempts to correct, and his comprehension is intact. So, looking at that, that's a lot of information. But regarding the patient's language goals, the scenario says that his personal goal is to be able to communicate using more words in various settings. Make sure that you're not getting confused between some of the phrasing on the praxis. So his goal is to be able to use more words, but the scenario also tells us that his syntax is intact. So a lot of times people can sometimes think of, well, if we want more words, that's probably going to mean he needs maybe grammatical markers or increased syntax, increased length of utterance, which could be true. That could be true. But when you read the case scenario and you read that his syntax is intact, you should think that yes, he needs to increase his use of content words, especially because, let's go back to the question here. It says that he makes semantic errors. So if he's making semantic errors, then he's probably got some paraphasias, maybe not able to use the right words, maybe getting stuck on some words. So those are the content words. So make sure we kind of are keeping our basics really kind of front and center when we're thinking about these longer scenarios. So You definitely need to be able to memorize information so that you can apply it. You can't apply information that you don't know. So make sure that even for these application questions, you really are kind of thinking about the basic information that you're going to need to know um, and apply. So let's go ahead and look at these answer choices here. So option A, script training to reestablish automatic speech in specific everyday situations. So that's option A. Script training, we know, focuses on fluency, can improve word retrieval, deficits in people with aphasia. And that really kind of matches the patient's language needs, right? He wants to be able to speak with more content words. However, we also need to think about what are the patient's goals? The patient's goals are to be able to communicate more effectively in a variety of different situations, not just one specific situation or two or three, in multiple different contexts. So script training is typically used when people want to be able to make a phone call or they want to be able to communicate something very specific in a very specific context. And a lot of times script training can be used to build more language skills on that so that, they're not just having to use that script. But overall, script training isn't really the best option for meeting the patient's language goals, his personal goals. So, and that is using an approach that would increase word retrieval abilities in the untrained tasks. Okay, so let's go on to option B, verb network strengthening treatment to improve word retrieval in untrained tasks. So this uses verbs to improve word retrieval and thereby enable production of whole sentences by using basic syntactic structures. So you're teaching people to use subject, verb, object sentence structures. And this definitely meets the patient's language needs. His syntax is already intact, so he's not going to have a hard time learning this basic structure, but we're going to be able to improve his word retrieval through it. The other thing too that this is good for is untrained tasks. It's something that you can use in multiple different settings, and it's applicable, in varying different settings. And somebody could use it in an untrained task, unlike script training therapy. So if we compare option A and option B, B is the better choice for now, but let's kind of look at the other choices too. So option C, treatment of underlying forms to improve sentence structure. We kind of touched on this earlier. Make sure you know what all the scenario, what all information is being provided, because they already said that his sentence structure is intact. They said his syntax is intact. So this isn't something that's going to be beneficial for our patient. Sometimes you can kind of eliminate the incorrect answers first. But if you can't, just go through and use a process of elimination using some of that recall information, and then also just kind of applying it to the scenario and thinking about how it fits in with the scenario. And there's nothing really tricky about these questions, so don't add any other information or make assumptions about the patient. Just use the information that is provided there.
Thank you, Tess. And we've provided the third question on the screen to the left. Could you tell us a little bit more about this question as well?
All right, so looking at this question, it's another application question. So it's asking you to make a treatment decision based on information presented in a scenario. Again, we recommend that you read the question first so that you know the focus of the item before reading the entire scenario. So this one's question, the question's question is, which answer includes 2 actions the SLP should take first for dysphagia management? So now we can look for some clues within that scenario that kind of will help us identify what are some of the first steps that you would take with a patient like this. And also just kind of remember, kind of cue into some of those key words like first, or another word might be primarily, or, you could just kind of pay attention to the timeline, what they're actually asking for. So they're asking what you would do first in this situation. So some strategies that we'll kind of think about for this scenario. Picture this individual in the case scenario as somebody that you might treat. It might just kind of help you tap into a little bit more of your professional experience, might help you make a little bit more, confident decision if you're thinking about it as a real person as opposed to just some, random scenario on a piece of paper. Next, I want you to just make sure that you're focusing on the information that's only provided in the scenario. So make sure to don't add anything else. Don't make any assumptions. And sometimes this is a little bit more challenging in some of these complex cases because if you have experience with dysphagia or some of these more complex disorders, you know that patients are not going to present like they do on paper, like in a scenario like this. Like typically it's going to be a lot more complicated in the real world than what's just presented on a piece of paper. So make sure to just take the information that they give you and just use that to make your decisions. Now, also, when you're looking at answers, so these answer choices, they both kind of have two parts. So you need to kind of evaluate both parts of each answer. So just kind of take them in chunks, take them one at a time. Is this true? Is this false? Evaluate in chunks. So let's go ahead and try to apply some of these strategies to our answer choices. So option A, answer A, the first part of answer A says provide education to the family, patient, and nursing staff on the importance of oral hygiene. Now, that's definitely something we would want to do with somebody who has aspiration pneumonia. Patient education is very important, nurse education very important, and also oral hygiene. This patient has aspiration pneumonia. Oral hygiene is really, really important. Second part of this question, or this answer, sorry, is recommend that the patient be put on a honey thick liquid diet honey thick liquids and pureed diet. So that's not correct. Remembering the question's question, imagining this individual as a real patient and relying on what the scenario tells us, and also avoiding any assumptions that we may have are going to be really helpful here. So the second part of answer A is recommend that the patient be put on honey thick liquids and pureed diet. Sorry there. So that's not correct. This SLP has only completed a bedside swallow assessment with this patient. They haven't completed anything else. Now, this is kind of where the real world and, a test may kind of differ. In the real world, if the patient hasn't, there may be a situation where an SLP may make that kind of recommendation. There may be. I'm not going to get too into that. But likely we are going to need an instrumental evaluation such as MBSS or FEES because this patient may be silently aspirating. Just because they're not coughing or choking on food and liquids doesn't mean stuff's not getting down into their lungs. So there may be a case, it may have happened before where an SLP has put somebody on a diet after a bedside swallow, but that's not going to be a typical recommendation. So we can eliminate option A with that. Answer B, provide education to the patient family and nursing staff on the importance of oral hygiene. I've already given that the thumbs up. Second part of B says recommend a modified barium swallow to identify the source of aspiration. Yeah, that definitely fits. That's something that would be really important. We need to know, why is this guy aspirating, or if he's aspirating. He has aspiration pneumonia, but we don't know if it's food and liquid getting down there. It may be just saliva. So you really need to, have a definitive evaluation to figure that out. So that option, option B looks good. Answer C and also answer D, they both have this recommendation of a chin tuck procedure to protect the patient's airway. Now, again, there may be a real case scenario where you do a bedside swallow evaluation where you really, notice an improvement with a chin tuck, and you're just waiting for an MBSS or a FEES, and this is just the safest thing for the patient to do in the meantime. So that certainly could exist out there in the world. However, recommending any postural changes without having an instrumental evaluation without having any solid information about the patient's swallow is not usually recommended. So we need to avoid making assumptions about the patient's swallow. So that is why answers C and D are incorrect. Answer D, we also kind of talked about, putting a patient on honey thick liquid and pureed diet just from a bedside swallow are not going to be very appropriate in this scenario. So kind of looking at all these answer choices now, kind of going back and looking at them, you also may be able to recognize that only one answer choice has that, you need to have an instrumental evaluation first. So once you see that, you might be able to kind of go through a process of elimination more quickly. But even if you haven't thought of, this reason before evaluating the options, once you have realized, it also just may make it a little bit quicker maybe to, eliminate some of the other options. You might not have to spend as long on them.
Thank you, Tess. And let's conclude the video with our last question. Could you tell us a little bit more about this one?
All right, so this question's question is, which of the following approaches could the SLP use to directly address Ken's fears about how others will react if he stutters? So looking at all of these answer choices, it just reiterates that we need to understand the basics, memorize treatment strategies, what they're used for, which populations they're best for. And that's true for all the disorders that we treat. We have to memorize for these tests the strategies and approaches we use. When you get out into the real world, you can have your little, pen and paper. You can have your list of strategies sitting right there. But for this test, we really need to memorize them. So one thing about this case scenario that's very interesting is it's very long. But then when we look at the information that's provided about the evaluation, it says that Ken speaks at a typical rate and produces no repetitions, prolongations, or blocks. So he doesn't present with any characteristics of stuttering. So looking at these options, we're not going to be using stuttering modification because he's not stuttering. We're not using fluency shaping because he doesn't need to have anything shaped. We're not going to be using smooth speech because he doesn't have bumpy speech. Option D is really the only answer that answers the question about what is going to be used to directly address Ken's fears about how others will react if he stutters. And that's cognitive restructuring. Which helps people kind of reframe and rethink about how, about how they feel about their stuttering. So that's the only answer choice that actually answers the question even. One thing to remember about these scenarios is that they can kind of be a little bit interesting. They don't give you all the information, and just for your knowledge base, just because somebody's not presenting with a stutter doesn't mean that they don't have a fluency disorder. Especially this patient, it sounds like he has used a lot of strategies to prevent any stuttering at all. And there are also people that learn to use like prolonged speech. And they become very, very, very good at it. And they can use it all the time. And they never stutter unless they stop using it intentionally. But because they still stutter when they're not using their strategies, they're still considered as having a fluency disorder. And so that's where cognitive behavior therapy, CBT approaches are really helpful for people like this who maybe just have a lot of anxiety, have a lot of difficult feelings about their speech, about the way they talk, even if they're not really presenting as a typical dysfluent person would. So
that concludes today's video. We hope that you found it helpful. If you haven't yet viewed the first 3 videos in this series, we encourage you to check them out. We provide links to these videos on our website. We wish you the very best as you prepare for the Praxis.